Hey, what's going on guys, it's Amir. In this video, I filmed a little Q&A session with Dr. Zafar, the head hair transplant doctor at Vera Clinic where I got my hair transplant from, as well as the medical consultant Yan. He is going to be the one translating in between Turkish and English in this video. So basically what I did was I took the questions from the last video, some of the burning questions that you guys have had about hair transplants and whatnot, and I presented them in front of the professionals and got them answered directly from there. So if you're considering getting a hair transplant done in Turkey or in general, you guys have answers to those questions. So without any further ado, I'm gonna go ahead and roll that clip, and I hope you guys found this video helpful. If you do, make sure to give it a thumbs up. I'm gonna go ahead and leave the mic with Dr. Zafar. He's the one who did my procedure himself. So go ahead and introduce yourself, doctor.
İsmim Zafer Çetinkaya. İstanbul Üniversitesi İstanbul Tıp Fakültesinden mezun oldum. Yaklaşık 9 yıldır saç ekimi alanında çalışıyorum. Şu an için Vera Klinik'te hizmet vermekteyim.
So Dr. Zafer Çetinkaya graduated from Istanbul University of Medicine in 2011. So he's been doing hair transplant for the last 9 years. Now he is the head doctor in Vera Clinic.
This is a common question that the viewers have. What are the risks of getting your hair transplant done in a country like Turkey versus just getting it done in your home country, other than just the cost factor?
Daha sonrasında bizim
I think that the main point is the experience. What could be seen abroad, whether in Europe or in the USA, is that the doctors over there don't get so much practice. Maybe they have one patient every second day, whereas here we get like patients coming from more than 80 countries, and we get a few patients in a day. So it's again a wealth of experience accumulated.
esas yani bahsetmek istediğim bu. Bir de bizim
Now, apart from that, I think Turkey and especially Istanbul has been geared towards this whole sector of hair transplant, whether being the doctors who are very qualified and very experienced, but at the same time the whole support team with the trichologist and the whole team that comes with it.
Bir de şunu belirtmek isterim. Yurt dışında yapılan operasyonlarda deneyim düşük.
Now, I think one of the very important point here is that in Europe or in the USA, there is a limitation for the number of grafts that's being transplanted. Therefore, the experience again is very limited. Whereas here in Turkey, we've been over the last 10 years experimenting a lot. So we've been pushing the boundaries, and thanks to this, we're doing what we call mega sessions over 2 days, where we can get like significant number of grafts, maybe like 5,000 or even more than that, in 1 or in 2 days. And that's also obviously adding a lot of experience. And in terms in Europe or in the USA, the doctors just doing every second day maybe 2,500 grafts, so they don't get the exposure that our doctors and our medical team is getting. And then this is what's really providing the edge.
And what would you say would be like a con?
Eksik yanı uzaklık. Belli bir gün
I think the main negative thing is the distance. The fact that the patient from the USA has to travel, has to take a few days off and come all the way here, and then here the follow-up will be done through telephone or through video conference, rather than maybe if you were in the USA it will be face-to-face. But having been doing this for years and years, we know exactly what needs to be done, so that everything it's not a reactive action, it's more like a proactive action.
Right. What qualifies a good candidate for a hair transplant procedure?
This is a very common question that comes very often.
Okay.
Biz bu konuda şunu düşünüyoruz. Eğer kişinin ihtiyacı varsa her yaşta yapılabilir.
Now, here, like the most important thing is what the needs of the patient, which is very diverse. I mean, you may have someone who's 20, 25 years old and really see this as a complex, and you may see someone who's 60 or 70 years old and may need this. So the first thing is the need of the patient. This is one way of approaching it. Yani ilk aşamada diyorsunuz ki işte ihtiyacı var ama en uygun nedir, ne zaman yani?
En uygun dökülme.
Now the first point is to understand the hair loss cycle. Ideally, you should do it at the end of your hair loss cycle, which could be very different from one person to another. But here, with the experience, what we see is that if you do like a smart planning, and then obviously there are also two factors. The first factor is, does the patient want to do only one operation, or is he okay to do like maybe 2 operations or 3 operations? And what the doctor says in terms of smart planning means like you need to take into consideration your donor area, and then just not over harvesting, really doing what's needed at the right age. Obviously, if people, patients are 20, 25 or 30 years old, they see there is a complex, there is a need for it, it's urgent, they're young, they want to solve that problem. So to tell them to wait maybe until 35 or 40 is maybe not the solution. Therefore, doing it with taking the precautions and doing it in a smart way might be the right way.
Can you speak a little bit about your current technology that you have compared to most traditional practices, like you mentioned Sapphire FUE versus traditional FUE, the Oxycure, PRP, laser therapy? How does all of that equate to getting the optimal results versus a traditional procedure?
If you don't mind, I'd like to answer this as a medical consultant. Now, the first thing is that the Sapphire technique was a technique that was invented from Vera Clinic back in 2017, and that's the reason why this is the technique that we always mainly use it. What are the main advantages of the Sapphire technique? It's a faster healing process. It's providing like a more natural look, and also it's providing a higher density.
Yöntem safir olarak bu şekilde. Oxycure hakkında.
Now, the Oxycure is a technology that was invented a year and a half ago from Vera Clinic. The main thing about this is that you get actually 2 sessions where you're put into a special chamber for about 1.5 hours to 2 hours, where we give you a lot of oxygen, an oxygen that you wouldn't be able to get in normal time. And the fact that you're oxygenating your blood, this is helping to get a faster healing process, but also, and most importantly, helping to get a higher survival rate of the newly transplanted grafts. Because one of the main points in hair transplants is a good circulation of blood. And the fact that you have more oxygen in the blood, you get a better circulation of the blood, which is strengthening the grafts in the process. Again, it's the same principle. One of the founding pillar theories of hair transplants is that to have a good growth of your hair, you need a good circulation of blood in your head. Now, the laser therapy, what it's doing is it's providing a certain level of laser light, which is helping to kind of expand the nerves that you have in the area of the transplantation, which is helping to get a better circulation of blood and more oxygen, and hence again is helping to strengthen the rooting of the newly transplanted grafts. PRP stands for plasma-rich platelets. The principle is that when you get the blood test during the consultation period, a part of it's kept and it's put into a special machine that is called a centrifuge, where the plasma-rich platelet, which is part of the blood, is taken. It's mixed with some vitamins and also what is called growth factor. And then we have 2 ways of doing it. We either inject it on top of the newly transplanted graft at the end of the operation, or we spread it, we inject it on top of it. And that again is really helping for 2 things. The first thing is like a much better healing process, and most importantly, going back again, the circulation of blood, the enriching is a bit like fertilizing that area, which is helping to get like a stronger growth process.
In terms of, let's say, since we are doing a Sapphire FUE technique, how fast is the recovery process in terms of the area that is the newly transplanted area compared to a traditional FUE, and as well as how long does the donor area take to recover after the procedure?
Now, the first point is like the blade that is used in the traditional FUE is a steel blade that has like a U shape. Whereas with the Sapphire, first of all, Sapphire is a precious stone. It's a bit like diamond or ruby. So it's very delicate, and it's got like a V shape. Therefore, that when you do the opening of the channels, is much neater, which is helping to get like a faster healing process, and also getting like a stronger growth. The recovery of the donor area takes in average 1 week to 10 days. After that, it goes back to more or less what is normal.
Okay.
So there's no scarring.
There's no.
That's what's recommended.
Are the scars permanent?
The scars are really small dots. But those small dots, and if you keep your hair longer than 1 centimeter, then you won't see it.
And this is a very, very frequent question that I've been receiving, and that is the newly transplanted hairs that you get from the surgery. Are those permanent, or are you bound to, since hair loss is progressive, are you going to lose the newly transplanted hair as well, and you're going to be due for maybe another operation in a few years down the line?
Belirlenen güzel bir alandan alındıysa kalıcıdır. Ama
now the main point here, and that comes with experience, when the follicular units are taken from the donor area, but from a certain part of the donor area, then it's there for life. But if it's not taken from the right place, then in some cases, it doesn't happen very often, but in some cases you may lose it. So that's the reason why the experience is very important.
Okay, so basically the hair that I have right now that I got transplanted, that's here for good.
Yes,
okay.
And I like to open a little bracket. I mean, the origin of hair transplant goes back in the 50s, where an American doctor actually realized that elderly people who are in their 50s, 60s, or 70s, they were never losing the hair at the back and on the side. So he observed them. He said, if I could extract the follicular units and transplant them into the bald area, that's a solution that stays forever, because we are genetically codified not to lose our hair in the donor area. So that's the thing behind.
Got it. So let's say after your transplant, how consistent should you stay on finasteride, as that's one of the things that you guys recommend? Although I know there's some people who might be afraid of the side effects of finasteride or Qualification.
Hastalarımıza eğer mümkünse operasyondan önce belli bir süre, bir
kadar.
2 ay.
So what we recommend actually before the operation, 1 to 3 months before, we recommend for the patient to take finasteride. And the main reason is it's really helping for the donor area. It fortifies the donor area. So during the operation, it's giving better results.
Operasyondan sonra da hastanın durumuna göre değişiyor ama ortalama 6 ay, 1 yıl civarında kullanmalarını istiyoruz.
And then after the operation, it's highly recommended. Obviously, it depends from one patient to another, but it's highly recommended to use it for at least 6 to 12 months.
And what about minoxidil?
Minoxidil konusunda düşünceleriniz?
Minoxidil de çalışma mantığı yani.
Now, the idea with minoxidil is the same with finasteride. What it does, it helps for the veins to get bigger, which is helping for a better circulation of blood. Hence, it's strengthening the donor area and the receiving area. Now, the thing with minoxidil is that, again, it's also recommended, depending on the patients, between 6 to 12 months. There's a very important point here, is that when the patient wants to stop minoxidil, it needs to stop it gradually, not at once.
Okay.
Otherwise, it could face some problems. Now, the recommendation of the doctor is that you should use minoxidil, finasteride, as long as you can, and then minoxidil for the next 6 to 12 months. And then when you want to stop minoxidil, you should give yourself like a period of roughly 15 days to 1 month, and then gradually on a daily or weekly basis, decreasing the amount that you've been taken. And then the other point is that in our clinic, because we have like a 12 months post-op follow-up team, which works very closely with the doctor, and we have all the information of the patients in our system, so we can really see who was advised what, and then we always ask also for photos and etc. to see we can follow up the case of the patient and make the proper recommendations.
Right. I think a very common concern that most people have is with finasteride there are going to be side effects. Personally, for me, I haven't had any side effects, right? But if someone, let's say, even if they're not getting a hair transplant and they want to have some sort of procedure to stop the DHT and to stop their current hair loss progression, they want to start finasteride. Or even, let's say, they got a hair transplant and the doctor advises them to take finasteride. What do they do when they see side effects? How can they get around the fear of taking finasteride?
Etkisi çoğu kişi biliyor genellikle.
The first point here is, I think, it's a very common thing, and people know about the side effect. It's more about the libido and the sexual side of it. The main point is if someone wants to become a dad, wants to have some kids, they may want to stop the use of finasteride. Other than that, if they don't have such a thing, then they may carry on. Onun dışında
bu yan etkiyi de %1
I think what the doctor says is that there is a bit of a myth about finasteride, thinking that you take a pill, you take finasteride, and all of a sudden you lose all the functions.
Right.
It's not like that. I think from his experience and the experience of the clinic, it's usually less than 1% of the patients that really see the side effect of it.
Mm-hmm.
So therefore, what's recommended is to use it, and if really they see any side effect, then they can stop it.
Yeah, I mean that's basically what I tell my viewers as well, because as soon as you see any side effects, you can always get off it and go about your life, and maybe think of another solution or use minoxidil, which is something more topical. I think they're also working on topical finasteride. I've heard.
There is finasteride.
Somebody asked, I'm looking to get a hair transplant too very soon, but I was advised to get an FUT for my first procedure to save grafts and make sure that I don't waste my grafts and over harvest since I'm so young. I will likely need multiple procedures throughout the year. For my future procedures, it will be FUE. Is this the most ideal approach?
Neden? Foot'ta yapıldığı zaman.
It's a multiple question. So the first question is the doctor thinks that FUT is a bit of an old technique which has a big minus, and the big minus is leaving a huge scar at the donor area. And actually we do receive some patients, especially coming from the US, who had a FUT in the past, and we do some correction because obviously with time the patient doesn't feel comfortable to have a huge scar in the back of the head. So to answer the first question, it shouldn't be an FUT, it should be an FUE. In regards to the over harvesting, this is not exactly like that, because if the patient needs 1,000, then we could extract 1,000 with FUE. If he needs 3,000, then we could extract 3,000 with the FUE. In terms of the strategy of thinking he's young and he should do multiple operations in the future, that makes sense. You could get 1, 2, 3 or 4 depending on the need and depending on the process of the hair loss, and therefore depending on how much he needs. With the FUE there is definitely a way to extract exactly that number and then transplant it, because there is a planning with it.
Of course.
Şimdi FUT'de çok...
Now again with the FUT, when you take a strip of skin from the back of the head, it's got like a limitation in the sense that you usually take a maximum of 2,000 follicular units, whereas the patient may be young but maybe needs like 2,500 or 3,000 follicular units, and therefore wouldn't be able to get the density that he would expect. Therefore, again, the FUT is quite limited in that sense.
Let's say you are young, you are in your early 20s, right? How many grafts would you recommend so that you are not over harvesting? Because for me, I got 5,000 grafts. Most people would consider that overdone, because in the US we do like 2,000 or 3,000 grafts. So now that I've done 5,000 grafts, what are some repercussions that I can face maybe 10 years down the line if I want a second transplant?
Graft daha alabildik mesela. Şu an 10.000 graft, 12.000.
There are a few factors to take into account. First of all, we can take back the Norwood scale, which goes from 1 to 7. So if someone is, and that patient was talking about was Norwood 7. He was young, he's 30, but the whole receding area was bald. So he came last year and he got 6,000 grafts, but his donor area was very dense and very strong. So there's the receding area and there's the donor area. If the donor area is very strong, it gives more opportunities. If the receding area is not so big, then it gives also more options to do it. So, and then he came back, that same patient came back last week, and then we transplanted another 4,000. And so he got the full area covered. It really does depend on which level of Norwood you are, and it does depend on the density of your donor area.
Got it. So I guess for me, I had a strong donor area, therefore I was qualified to do 5,000 grafts. So there's a qualification process that goes through before you suggest how many grafts go into it.
It's exactly like that. I mean, there is in our clinic, what we do is every patient is unique, and the important thing is to make sure that, you know, if we believe the patient will not get good result, we tell the patient exactly what's expected. It's transparency. And every case is very, very different. As I said, you know, the skin of the person, the age of the person, the health condition. But two main factors is really the donor area, the side and the back. If it's very dense, this gives you a lot of opportunity. And then if you're not a Norwood 7 and you're rather a Norwood 1, 2, 3, then it's a much easier situation.
Alright guys, thank you so much for watching. If you guys did find this video helpful, be sure to give it a thumbs up. I hope this video definitely gave you some further insight and some more information if you're considering getting your hair transplant done in Turkey or at Vera Clinic specifically, which is where I got my hair transplant done from. And if you guys have any more questions about any hair related questions, drop them in the comment section below and I'll try to answer them to the best of my ability. I'll also leave my email in the description below as well, so you guys can go ahead and reach out to me there. Other than that, thank you so much for watching. I'll go ahead and see you guys in the next video. Peace.